The first warning sign of a serious health problem is often not a dramatic pain or a sudden emergency. Sometimes it is something so small that you almost ignore it. A tiny change, a strange sensation, a little bump in a place you never expected. And when it comes to an inguinal hernia, that small signal can be your body trying to tell you something important. Imagine noticing a small lump near your lower abdomen or groin. It does not hurt. It does not stop you from walking. It does not seem dangerous. So you tell yourself, maybe it is nothing. Maybe it will disappear. But months later, that same little bump is still there. Maybe it has grown. Maybe it feels different. And suddenly, what seemed harmless becomes something that needs medical attention. An inguinal hernia is one of the most common types of hernias, affecting millions of people around the world. It happens when tissue, often part of the intestine or abdominal fat, pushes through a weak area in the lower abdominal wall. At first, it may be easy to miss, but the body often gives clues before the situation becomes serious. The problem is that many people ignore these clues because the symptoms can appear slowly. There may be no major pain at the beginning. There may only be discomfort, pressure, or a change that feels unusual. But knowing these signs early can help you take action before complications develop. In this video, we are going through the important warning signs of an inguinal hernia. Some symptoms are obvious, others are subtle and can easily be mistaken for something else. And the final signs are the ones you should never ignore because they can signal an emergency. So, let's begin with the first and most recognizable sign. The first sign is a noticeable bulge in the groin area. For many people, this is the moment when they first realize something is different. They may notice a small swelling near the pubic area, usually on one side of the groin. It might appear while standing, changing clothes, taking a shower, or looking in the mirror. At the beginning, the bulge may be soft and painless. It may even disappear when you lie down. Because it does not immediately cause discomfort, many people assume it is just a temporary swelling, a muscle issue, or something that will resolve on its own. But an inguinal hernia is different. That bump is often caused by internal tissue pushing through a weak point in the abdominal wall. The abdominal muscles normally hold everything in place, but when there is a weak area, pressure from inside the abdomen can force tissue outward. One reason people delay getting it checked is because the lump can look harmless. It does not always come with severe pain. It may simply sit there quietly, almost like your body is giving you a warning that is easy to overlook. In men, the bulge can sometimes extend downward toward the scrotum. In women, it may appear closer to the upper thigh or groin region. The location can vary, but the important thing is noticing a new lump or swelling that was not there before. A new, unexplained bulge in the groin is something worth discussing with a healthcare professional. Even if it does not hurt, it is still a sign that something has changed inside the body. Now, the second sign reveals something even more specific. The bulge becomes more noticeable when you move, cough, or strain. A hernia often reacts to pressure. Think about what happens inside your body when you lift something heavy, sneeze, cough, exercise, or even strain during certain activities. The pressure inside your abdomen increases. When that pressure rises, it pushes harder against the weak area where the hernia exists. As a result, the bulge may become larger or easier to see. You might notice that the lump appears more clearly after a long day of standing. Maybe it becomes more obvious when you pick up something heavy. Maybe you cough and suddenly feel a small swelling push outward. This pattern is an important clue. A normal area of swelling usually does not change dramatically depending on your body position or activity. But a hernia often follows a pattern. It responds to pressure because the tissue is moving through a weak opening. Doctors often look for this behavior during physical examinations. They may ask a person to stand, cough, or gently strain while checking the area. The reason is simple. Movement and pressure can make the hernia easier to identify. Pay attention to your body's patterns. A lump that appears or becomes larger during physical effort is not something to ignore. Now comes a symptom that confuses many people because it can create a false sense of safety. The third sign is when the bulge disappears when you lie down. At first, this may seem like good news. You stand up and notice the lump. Then you lie down and suddenly it becomes smaller or disappears completely. It can feel like the problem has fixed itself. But that is not what is happening. When you lie down, gravity changes. Your abdominal muscles relax. The pressure inside your abdomen decreases. Because of this, the tissue that pushed outward may slide back into its normal position. The hernia has not disappeared. The weak spot is still there. This is why some people live with a hernia for a long time. They see the bulge come and go and assume that because it is not always visible, it is not serious. But a disappearing bulge can actually be a classic feature of a hernia that is still moving freely. It may go back inside today, but that does not mean the problem has healed. The important question is not only, does it disappear? The important question is, why is it appearing in the first place? A hernia is caused by a weakness in the abdominal wall. Without medical evaluation, that weakness remains. This is also why early awareness matters. When a hernia is recognized before complications occur, treatment decisions are usually easier. Now, the fourth sign is one that many people mistake for a simple injury. The fourth sign is a burning or irritated sensation around the groin area. Not every hernia causes obvious pain. Sometimes the first uncomfortable feeling is a strange burning sensation near the bulge. It may feel like warmth, tingling, irritation, or a sharp, uncomfortable feeling that comes and goes. This happens because the tissue pushing through the abdominal wall can place pressure on nearby nerves and surrounding structures. When nerves become irritated, they can create sensations that feel different from ordinary muscle soreness. Some people describe it as a burning feeling. Others describe it as a pulling or pinching sensation. The discomfort may stay in the groin area or sometimes spread toward nearby areas. The confusing part is that many people connect this feeling to everyday causes. They think they pulled a muscle while exercising. They think they slept in a strange position. They think it is just normal soreness. But if the sensation keeps returning to the same area, especially along with a bulge or pressure feeling, it deserves attention. The body often communicates through repeated patterns. A one-time discomfort may have many explanations, but a recurring burning sensation in the groin, especially with swelling or changes in appearance, is a clue that should not be ignored. And the next warning sign is even more common. It is something many people experience but often dismiss as normal aging or daily fatigue. A deep aching feeling in the groin can be another important sign of an inguinal hernia. This type of discomfort is usually not a sudden sharp pain. Instead, it feels like a dull ache, soreness, or heaviness that slowly builds. You may feel fine in the morning, but after hours of standing, walking, or physical activity, the discomfort becomes more noticeable. Many people simply get used to it. They tell themselves they work too hard. They blame their routine. They assume it is just a minor strain. But when discomfort keeps returning to the exact same location again and again, it is worth paying attention to. The body is often very good at sending repeated signals when something is wrong. The challenge is recognizing those signals before they become impossible to ignore. An inguinal hernia may start quietly, but the signs are there. A new bulge, a lump that changes with movement, a swelling that disappears when lying down, burning sensations, a deep aching feeling. These early symptoms are your opportunity to notice the problem before it reaches a more dangerous stage. But there are more warning signs that reveal how a hernia can affect your daily life, and some of them are even easier to mistake for ordinary discomfort. As an inguinal hernia develops, the symptoms can become harder to ignore. At first, it may only be a small change that appears and disappears, but over time, the body starts sending stronger signals. These signs may not always feel severe, but they can reveal that something inside the abdominal wall is under stress. The fifth sign is a feeling of pressure or heaviness in the groin. This sensation is different from normal soreness after exercise or physical activity. Many people describe it as a strange feeling of fullness, like there is extra weight sitting in the lower abdomen or groin area. It can feel as if something is pulling downward or creating pressure from the inside. The reason behind this feeling is simple. A hernia occurs when tissue pushes through a weak area in the abdominal wall. That tissue takes up space where it normally should not be. As a result, the surrounding muscles and tissues experience pressure. At first, this heaviness may only appear after certain activities. Maybe you notice it after standing for several hours at work. Maybe it appears after walking a long distance or doing household tasks. You may feel normal when you wake up, but as the day continues, the sensation slowly becomes more noticeable. This happens because gravity and movement place additional stress on the weakened area. When you remain upright, the pressure inside the abdomen can encourage the hernia to push outward. Many people ignore this feeling because it is not always painful. It can feel like a minor inconvenience rather than a health concern. But a repeated feeling of heaviness in the same area is something worth noticing. Your body does not create the same warning signal again and again without a reason. If your groin consistently feels heavy, full, or like something is pulling downward, especially along with a bulge, it may be a sign that your body is dealing with a hernia. The sixth sign is pain that becomes worse with physical activity. This is one of the clearest ways a hernia can reveal itself. Certain movements can increase pressure inside your abdomen, and when that happens, discomfort often becomes stronger. You may notice pain while lifting heavy objects. It may happen when you bend forward, cough forcefully, sneeze, exercise, or climb stairs. Sometimes the pain appears suddenly during a specific movement and then improves once you stop and rest. This pattern is important. A typical muscle injury often causes pain that continues regardless of what you are doing. But hernia-related discomfort often follows pressure. When pressure increases, symptoms become stronger. When pressure decreases, symptoms may calm down. Think about lifting a heavy box. Your abdominal muscles tighten. The pressure inside your body rises. If there is a weak area in the abdominal wall, that pressure can push against the hernia, causing pain or discomfort. The same thing can happen during coughing. A strong cough creates a sudden increase in internal pressure. For someone with an inguinal hernia, that force can make the bulge appear more clearly or trigger a painful sensation. Many people first notice this symptom during everyday activities. They may not discover the hernia while resting. They notice it while working, exercising, or doing something that requires effort. The body is giving a very specific message. Something changes when pressure increases. If you repeatedly notice groin pain during lifting, bending, coughing, or straining, it is important not to dismiss it as ordinary discomfort. The seventh sign is a dragging sensation in the lower abdomen or groin. This symptom can be difficult to describe because it is not always sharp pain. Instead, it feels unusual. Some people describe it as a pulling sensation. Others say it feels like something is gently tugging downward. Because the feeling is vague, many people do not connect it with a hernia. They may blame bloating, they may think they are tired, they may assume it is caused by aging or a busy lifestyle. But a repeated dragging sensation in the same location can be an important clue. When tissue pushes through the abdominal wall, it creates tension in the surrounding area. The muscles and tissues around the hernia may feel stretched or irritated. Over time, this can create a constant awareness that something feels different. You may notice it more after spending a long time on your feet. Standing increases the effect of gravity and can make the sensation stronger. Sitting down or lying flat may provide relief because the pressure decreases. This is why some people describe a pattern where they feel uncomfortable by evening but better after resting overnight. The danger with subtle symptoms is that people often wait until they become severe. They think that because the discomfort is manageable, it cannot be important. But many medical problems begin with mild signals. Recognizing those signals early gives you a chance to respond before the condition becomes more complicated. A dragging feeling may seem small, but when your body keeps repeating the same message, it deserves attention. The eighth sign is swelling or discomfort that spreads toward the testicular area in men. An inguinal hernia develops in a passageway called the inguinal canal, which is located in the lower abdomen. In men, this area connects toward the scrotum. Because of this connection, a hernia can sometimes extend downward. When this happens, a person may notice swelling, pressure, or discomfort around one side of the scrotum. This can be alarming because swelling in this area naturally creates concern. People may immediately worry about other conditions. That is why any new or unexplained swelling should be evaluated by a healthcare professional. A hernia that moves downward can create a heavy feeling. The area may feel stretched, uncomfortable, or more sensitive than usual. Sometimes the swelling becomes more noticeable after standing or physical activity. The reason is the same as before. Increased pressure can push more tissue outward. For some people, this symptom develops gradually. They may notice that one side looks different from the other. The change may seem small at first, but over time it becomes more obvious. This is a sign that the hernia is affecting a larger area and should not be ignored. Now, while these symptoms can be uncomfortable, there is another important stage that happens when the situation begins changing from manageable to concerning. A hernia that was once soft and easy to move can become more difficult. The ninth warning sign is increasing tenderness around the hernia. When a hernia is soft and can move back inside, it is often less concerning than when it becomes firm, painful, or sensitive. A change in the way the hernia feels can be a sign that something has changed internally. You may notice that touching the area causes discomfort. The skin may feel stretched, the lump may feel harder than before, the pain may no longer disappear with rest. These changes happen because the tissue inside the hernia may be experiencing more pressure. In some cases, the opening in the abdominal wall can trap the tissue, preventing it from moving freely. This is where people need to pay closer attention. A symptom that slowly changes from mild discomfort into constant tenderness should not be ignored. The body may be showing that the situation is becoming more serious. A common mistake is waiting until the pain becomes unbearable. but healthcare decisions are often easier when problems are addressed earlier. If a hernia changes in size, becomes painful to touch, or suddenly feels different from before, that change matters. The next sign is the most serious one yet. It is the point where a hernia can become a true emergency. Because while many hernias develop slowly, there are situations where the trapped tissue loses its normal blood supply. And when that happens, time becomes extremely important. The most dangerous stage of an inguinal hernia is not when it first appears. It is when the body starts showing signs that the tissue may no longer be moving normally. A hernia that was once small, soft, and easy to ignore can suddenly become a serious medical problem. This brings us to the final and most important warning sign. The 10th sign is a hernia that becomes trapped and causes severe symptoms. Normally, a hernia may move in and out. The bulge may appear when you stand, cough, or strain, and then reduce when you rest. But sometimes the tissue that pushes through the abdominal wall becomes stuck. Doctors may describe this as an incarcerated hernia. When this happens, the bulge can no longer move back into its normal position. It may feel firm, swollen, and painful. The person may notice that the lump that used to disappear suddenly stays in place. This change is important. A hernia that becomes stuck is not behaving the way it normally does. The body is sending a stronger warning signal that something has changed. You may notice increasing pain around the area. The discomfort may become constant instead of appearing only during activity. The lump may become more sensitive when touched. The skin around it may appear stretched or irritated. These symptoms should not be ignored. Many people make the mistake of waiting because they have experienced the hernia coming and going for months or even years. They assume that because it was not dangerous before, it cannot suddenly become dangerous. But hernias can change. A condition that was manageable yesterday can become urgent when the tissue becomes trapped. And this leads to the most serious complication of all. The 11th sign is a possible strangulated hernia, which is a medical emergency. This occurs when the trapped tissue does not receive enough blood supply. Blood carries oxygen and nutrients that tissues need to survive. When that flow is restricted, the affected tissue can become damaged. This is a situation where waiting can be dangerous. The warning signs can appear suddenly. Severe and worsening pain in the groin area is one of the biggest red flags. The pain may feel much stronger than anything experienced before. Another warning sign is nausea or vomiting, especially when it appears together with intense abdominal or groin pain. You may also notice that the hernia bulge changes color. It could become red, purple, dark, or unusually swollen. The lump may feel extremely tender and may no longer move back inside. Some people may also experience difficulty passing gas or having a bowel movement if part of the intestine is involved. These are not symptoms to monitor at home and hope they improve. A strangulated hernia requires urgent medical care because the longer the blood supply is blocked, the greater the risk of serious complications. This is why recognizing the earlier warning signs matters so much. A small bulge is easier to address than an emergency situation. Mild discomfort is easier to evaluate than sudden severe pain. Paying attention early gives you more options. The important lesson is simple. Your body often gives warnings before a problem becomes severe. A small change today can be a valuable clue for tomorrow. If you notice a new bulge, repeated discomfort, or any unusual symptoms in your groin area, it is worth speaking with a qualified healthcare professional. Only a medical evaluation can determine what is actually happening. Remember, this information is meant for awareness and education. It is not a diagnosis and should never replace advice from a healthcare provider. Your health is built on paying attention to the signals your body gives you. Sometimes the quiet signs are the ones that matter most. If this video helped you understand the warning signs of an inguinal hernia, share your thoughts in the comments. Have you or someone you know experienced any of these symptoms? Your experience may help someone else recognize a warning sign they have been ignoring. If you found this information useful, consider liking the video and subscribing for more health awareness content that helps you understand your body better. Take care of yourself, listen to your body, and remember that early awareness can make a powerful difference.